Hi, everybody. My name is Jennifer Cunningham, and I'm the AVP for Alumni Relations at Lehigh University. Thank you all for joining us today on what is our record-breaking number of participants in a Mountain Talk. Over 500 alumni, family, and friends signed on today. We generally see about a third of that people actually participate, and then a lot of people do download the recording, which we are doing today as well. So if you have to drop off early, you can always go back. We'll send you the link to get the recording. We are here today, of course, to talk with Dr. Chris Liang. The title is Helping Kids, Caregivers, and Teachers Cope During COVID-19 Changes. He's an associate professor and chair of the Department of Education and Human Services with Lehigh's College of Education. A couple of housekeeping notes before we get started. As I mentioned, we're up to now 212 participants, which is fantastic. The way to ask your questions today is through the chat function, not through voice. You might be used to doing Zoom voice calls, but you can imagine with over 200 people, the voices would get a little unwieldy. So the chat box is the best way to ask your question. If you go to on a desktop or laptop at the bottom of your screen, you'll see a little cartoon thing that says chat. Just click that and a box will pop up and then you can ask your question. I will read Dr. Liang the questions as we go along so he can focus on giving you answers. So Dr. Liang is going to speak for a few minutes and just tell us what he's doing, what he's been up to in the last few weeks, and then we'll turn it over to you for your questions. All right, Dr. Liang, take it away.
All right, thank you so much, Jennifer. Good afternoon, everyone. I hope that you all are as healthy and as safe as you can possibly be during these times. I do hope that we'll have some time to chat later on. I have some prepared thoughts for us all, and I hope to be able to engage you all in some sort of conversation afterward. I first want to just thank Lehigh University for organizing this meeting and for inviting me to provide some of my thoughts on this pandemic and what we're all experiencing right now, this collective stress, this collective trauma that we're all going through. I also want to just quickly acknowledge that I have children and I'm working from home. And so you may hear them from time to time. Like many of you with kids, that's just a constant part of the struggle that I'll also talk about with you later. And I just want to acknowledge that I couldn't even be involved in this talk were it not for my partner who is managing the kids right now. So it's a collective effort on our part. And for those of us who are lucky enough, we have a partner who is able to do that. So I was asked to talk about 5 minutes. And in that short amount of time, I hope to be able to share with you some of my thoughts. And the first thing I want to say is that caring for others is, during this time, is paramount. And it's so critical, particularly to young people, whether you are a caregiver or an educator or a healthcare provider. You know, for our kids, we are the source of stability that they need. And so what that means is that we as individuals, as adults in their lives, need to be able to care for ourselves first. Like the flight attendant says on the aircraft when we're boarding the plane, you have to put the oxygen on yourself first before you put it on your child. If we're not taking care of ourselves, we're not going to be able to provide the stability and the care that our kids are going to need. I also want to say that for each of us, for the youth and also for us as adults, we have our own unique histories and conditions that we need to acknowledge. Those histories and conditions contribute to how we are going to experience the stress, how we're going to cope with the stress. Our coping strategies are shaped by our histories, our individual trauma histories, family functioning, and right now they may be our coping strategies may be really stretched because of our employment history, our employment status, and these are all things that are unique to us as individuals. And so there is no one way for us all to be coping or experiencing the stress. We have lots of individual level variables that are affecting us all. What I also want to say is that, COVID-19 does not seem to be discriminating in who it infects. But we do know from the emerging data that the most vulnerable of our populations, the people who are living in poverty, the people who are the working poor, the people who have to stay working right now, people of color in our communities, are the ones who are most at risk for exposure and infection. And these are things that we need to acknowledge and we need to be thinking about also when we're thinking about care for others. So I don't want to make any assumptions about who the audience is right now. So I just want to acknowledge that there's a wide diversity of people in our audience. I also want to say that young people and individuals who are exposed to childhood trauma and violence within their family system before the pandemic may be experiencing that adversity even more acutely now, particularly with adults being stressed and stretched in all the different ways that they are. These are times when supportive systems are really needed. And unfortunately, systems like schools are closed. And those are the places where kids who've experienced trauma would typically have experienced the type of supports that they need. That's the place where they would have typically experienced the type of structure that they need in their lives in order to stay focused on their education. I also want to acknowledge just real quickly that I was asked to talk about how individuals can provide care and how they might be able to cope. The framing of the talk is a little misleading, at least from my perspective, because at least for me, I don't look at individuals in a vacuum. Individuals exist within systems. And because of that, we can't divorce individual coping and care from what the federal, state, and local governments and employers are communicating about health, well-being, and work. So with respect to government officials, clear, consistent, and scientifically informed messaging needs to continue at all levels to provide a feeling of safety and stability for all, for young people and adults. With respect to work, employers should consider the health and well-being of their employees, and this means providing structure to their employees, being clear and flexible in expectations, recognizing that all workers are doing their best given the stress of COVID-19, the new responsibilities that adults have to work, care for kids, and teach at home, while also ensuring the health and safety of their loved ones. And unfortunately, as we're going to start seeing more and more, those adults are going to have to balance the need to do all of those while also grieving for people that they may have lost in their lives. All that said, I do believe that there are things that individuals can do to help mitigate the effects of the stress that we're all experiencing as a result of COVID-19. So what can we do? Well, as I said earlier, we need to start with the self. And that means we all need to engage in some self-compassion, right? So while we're also being compassionate toward others, we need to be compassionate toward oneself. And that means that individuals need to recognize that there is no perfect or best way to handle the uncertainty or the stress or the rapid speed of change that we've all experienced in the last 3 weeks. There's no perfect way, there is no one way. It's going to be very individually tailored, and we need to recognize that we're all doing the best that we can to manage the changes that we've all experienced. I mean, rapid changes in all aspects of our lives. In 3 weeks, we've had to change everything, major upheavals to not just ourselves, but to our kids. And these are things that typically take years, if not decades, to take place, and we're doing it in 3 weeks. So I think a good deal of self and other compassion, perspective taking, and patience is needed. And if we can maintain those healthy expectations of self and others, and if we're able to care for ourselves, we'll do that much better in really exhibiting the type of care and stability that young people need. The other thing that is needed, I believe, is a clear communication. Clear communication with young people, with kids, and with the other adults in your life, whether they're your employers, your coworkers, your partner, your parents. Being clear in what the needs are is really needed. My partner and I have just been really fortunate in the way that we've been communicating, and there are definitely times when I'm not able to give as much of my time to caregiving as I would like, but because we're communicating with one another and we're setting the expectations more clearly, we're able to project some more stability for our own kids. And I think that's what all parents need to be able to do right now. So if you are partnered and you have another caregiver, communicate. Self-regulate first, communicate, try to stay calm, and our young people will benefit a ton when we're able to do that. If you're alone and a single parent, I hope that you are able to find some sort of support through some type of web-based service and telehealth service so that you can communicate your stress and learn different types of strategies that might be helpful in this particular situation. But for all of us, whether we're single or partnered, we need to remember that we've experienced stress before. Perhaps nothing like this. None of us have experienced anything like this before. But we've learned things from our previous experiences of stress that we can use now, and we need to be able to identify that. Young people and adults also need structure and routines. The closure of schools and other systems is needed, and it's certainly needed, and it's also disruptive. And so teachers, I hope that those of you who are listening, I know you're incredibly stressed, and I value you so much, and you've done so much work in translating everything you've done, in a face-to-face format and online. I would just hope that your supervisors are encouraging you to be flexible while also providing clear expectations for you that are obtainable. There's a lot more that I can say, honestly, but I'm also really aware of time. Let me just close by saying that I think it's really also important that we minimize consumption of news. If you're finding yourself with the television on at all hours of the day, stop. Minimize it to just once or twice a day, maybe at the beginning and sometime in the early evening, so that you can learn what's going on. But don't watch it all the time. It's not healthy. And also stay connected to people. Engage in some type of networking through the use of web conferencing, video conferencing. It's healthy and helpful. We need to stay connected, particularly in these moments. We also need to recognize that together we will be able to overcome this. We will come out of this. And at that particular time, we'll figure out what this all means for us. But right now, we're still in crisis management mode. We're getting a little past crisis management mode. But it'll take us all some time, and we all have our own individual cases. So again, be compassionate toward oneself. I'll stop there and take any questions or comments.
Great. All right, attendees, again, click on the chat function down there, and you will see on the bottom of your screen, and you will see a window pop up, and I will see the questions. While we are waiting for people to put their questions in, oh yes, there's where you put your question. You mentioned telehealth. That is presumably where you find a counselor or a therapist. Are there any services that are particularly helpful, especially for people around, education? How do I homeschool? Or are there any that are popping up that you found to be really helpful?
Great question, Jennifer. You just reminded me, actually. I've my team and I, my research team and I, the Gender, Race, Inclusion, and Trauma Lab, in conjunction with Resilient Lehigh Valley, has spent the past week putting together some resources for individuals. And I can share with you the screen right now. It looks a little overwhelming, and there's a lot of information here for caregivers and also for educators, and also for parents who are trying to help their kids learn at home.
Mm-hmm.
You'll see these resources here, and what we've done is we've also translated as much as we could into Spanish, because we know that in our local Lehigh Valley, there are many bilingual and Spanish-speaking only families, and we wanted to be able to provide as much support as we could. And you can access these resources just by, you can email me at christopher.liang@lehigh.edu. And it may take me 48 hours to get back to you, but I will email you the link. Again, this was a website that, is just a compilation of resources that my team and I have found in conjunction with Resilient Lehigh Valley. Yeah.
And we'll share this out too when we send the follow-up to all panel or to all the attendees. We'll also include this this link. Thank you so much. I think the first question we got was advice for caregivers who need to self-regulate before they communicate, and how to do this quickly and effectively. I just glimpsed that there was a whole thing about breathing, deep breathing. Is that kind of the number one?
Yeah, that's so important. So I can pop that screen back up again. But yeah, one of the things that's really important for us as adults to be able to do and to model and to teach for our young people is these really important self-regulation strategies. And I'm not perfect at it. There are times when I get rattled. And so there is no perfect in this. It's a practice, and we continue to get better and better every single time we do this. But there is no perfect. But there are strategies that we can use. I've found in my own life that the more pressing an issue feels, the quicker that I need to come up with a solution, the more time I give myself to actually make the solution or action. That's when you know that you are more likely to act on impulse. So you got to take a deep breath and really be aware of your body and what your body is telling you. Your kids, your students might be needing a lot. We can't be everything and to all people, and certainly not when we're dysregulated. So take a deep breath, give yourself some time. And the slower you go, the faster you get there. It is a saying that I give to a lot of the students that I teach. I think it's really important. It's an old Native American saying that just resonates with me so much.
Yeah. Well, this is a perfect question to ask now. Michelle E. asks, as a Head Start teacher, the families in my classroom are at risk by the nature of our dynamics. I have made myself available to the families. Where did she go? The questions are coming in really quickly. I've made myself available to the families via cell phone, email, and Zoom meetings. How do I manage to stay available, yet have parameters so I can be more available to my own family?
Wow, great question. And you're not alone in doing all these things that you're doing. And thank you first for thinking of your the students and families that you're working with. They are at a really high risk. What I would say is that we're not going to be able to put out all the fires. We're not going to be able to to address every single issue that comes up at all hours of the day. And if you're able to set some parameters, these are the times when I can do this particular task. Because there are going to be times of the day when you're going to have to engage in other tasks that's related to your job. other tasks that's related to providing care for your own children if you have children. And other times when you're going to have to spend time taking care of yourself. So you can't be doing all these things all at the same time. So if you can, right, and I know it's a lot easier said than done, try to build some times where you're going to focus on those tasks. And if you're able to provide that structure for yourself, then your day won't feel so as overwhelming as I'm sure it does right now. And if you can, redirect and find some other partners. I don't know your situation, but if there are other colleagues who can help out, if there are community mental health resources that you can access and identify, make use of those. Many of our Lehigh Valley mental health providers, our community-based mental health providers that provide low-cost mental health services, have moved their services online. Our partners at Resilient Lehigh Valley have informed me that that they're ready to provide some services. If you go to the Resilient Lehigh Valley website, you should be able to find some of the providers in the area who are doing this. I believe on our own website here that is from Trello, I posted on Trello, you'll be able to find some of those resources there as well.
Great. Lots of comments of people thanking you for that Trello resource. So yes, folks, we will definitely send out that link. So you don't need to email Dr. Liang yourself. We'll send that out for you. There's a few questions in here about motivating students to actually do the work that all these wonderful teachers are sending. Specifically, like, can we just let them sleep till noon if that's what they want to do at this point? How do we motivate, I guess, younger kids and teenagers to actually do the work?
Yeah, I think that depends on who's doing the motivating. I think that for this at home, this starts with families. Providing some of the structure at home. This is not a vacation. It feels like one, but it's not. It's not a snow day. It might feel like one, but it's not. This is a change where we're hoping that kids can, get some enrichment, where kids can still learn some new information. I do believe school districts are modifying their expectations to meet the new realities and encourage them to continue doing that and to communicate that clearly with their teachers so that teachers aren't feeling as though they need to live up to expectations from a month ago when things were normal. Things are not normal, and as a system, we're going to have to adapt. This is not necessarily just a kid issue or a teacher issue. This is a systems issue. And I'm hoping that our state leaders will come up with a solution for us all. But I do want to get back to the issue of motivation in young people. I think we want to also make sure that young people are feeling safe and secure. And so their lack of engagement may suggest lack of clarity on what these off days are, on what the expectations are. But it also may be a function of them feeling really at a loss, feeling blue, feeling sad at the things that they've lost. We've all lost a ton here. Our way of life has changed, total upheaval, and our kids have lost their sources of support. Remember, adolescents in particular, the people who are most important to them aren't necessarily their parents or the adults, it's the peers, the peer group. So trying to encourage the kids to stay in touch with one another in healthy ways using social media, and they're more adept at that than we are as adults, certainly as middle-aged people, I'm sure. Encouraging them to have some of that time is going to be important. Healthy conversations about what that's going to look like, what those conversations with their peers are going to look like is important. We don't want them just, drowning in misery together. But having that contact can provide some sense of normalcy, which is really important. So I want to be careful about, thinking that some kids are not motivated to do work and that may be the case, but it also may be that they're experiencing some dysregulated moods at this particular moment.
Yeah, I think a lot of what's the questions around this, there's a lot of questions in here about how to manage all the things that people have to do and trying to put them in order. Like my kids come first, then my job, then the rest of my family, and from what I'm hearing you say, there is no one right order at any given time. It's just what you need to do. Can you maybe reassure us a little bit about the learning? I think we're all afraid that our kids are going to fall so far behind. Several people in here have said, like, either really young children. I have a kid with an IEP who's not reading every day, is not getting the individual attention he usually does. Is it okay that there's a lapse in the regular education? Are they going to end up when they're 30 years old, so far behind, or should we worry?
Wow, I feel it right here in my heart.
Yeah.
Parents are wanting what the teachers are wanting. Everyone wants what's best for the kids. You want, for your kids, whether they're your students or your own kids, to be healthy first and foremost. And you also want them to continue to grow and to learn. And, I'm not so certain that we can have the same expectations kids right now.
Yeah.
We're all learning. Many of us are learning how to learn online and teach online. And many of us are struggling. I'll say it for myself. Like, how do you balance being a parent, caregiver, and a worker? And it's, we're in it together, and there is no one right way. We're doing the best we can. I'm really curious to know what the state is going to do with regard to falling behind, quote unquote, falling behind. If all of our kids are not getting the instruction that they're typically used to right now, how will the state answer that question? What they do in the future? Will the next year, will the first part of the next year, the next academic year, be spent on, on getting all the kids caught up? Is that how the state will handle it? I'm not sure. But I'm not sure that pushing kids right now, to the same expectations that we've had before, is possible.
Right.
Particularly given the disparities and the gaps in, in access to technology. What's going to happen is we're going to see an increase in the gap between those who have and those who don't have. So it's really hard to imagine that we as a culture can accept that we're going to just go business as usual and expect all kids to have the same access and opportunities as they did before.
Right, and I think some of the teachers, it sounds like there are a lot of teachers on our call today, wondering, how can they reach out? One, particularly, Tiffany is asking, what resources are currently available for kids who are now in situations and environments where they're more prone to abuse now that they're forced to be in quarantine with the perpetrators, especially since the police and other first responders are now limited. Do you have resources on Trello for that, or is there another source?
We did look at that issue, and this is something that actually Dr. Roy at Bethlehem Area School District, he did communicate with me, about the needs for caregivers, for teachers, and he being someone who is trauma informed, was thinking about this as well, and we're working on developing those resources. I don't remember the name of the individual who mentioned that question, but it is an issue that we've been thinking a lot about in my team. How do we protect those kids? How do we protect those kids who've already experienced trauma and are now even at greater risk for experiencing even more trauma, particularly when their parents are even more dysregulated. It's something that our partners at United Way and Resilient Lehigh Valley have talked about as well, and our partners on that group have, you know, um, have been doing a lot of thinking about this. But these are, we're trying to figure out our way through this.
Are there any things like hotlines that people can call?
Yeah, I mean, I would say that you can still call the old hotlines that were in existence before, and reporting, child abuse and reporting. We still should be doing that. We still should be protecting kids and young people from that. And so, all of those old resources that we've used, 3 weeks ago, 4 weeks ago, we should still be using now. We should still be reporting, what we've learned. And I think one of the more challenging parts is understanding when things are happening since we've lost contact with the kids, the face-to-face contact. So we're going to have to figure that as well. I mean, these are definitely, unprecedented times, uncharted waters, and we're going to have to try to figure this all out together. And if people have ideas, certainly feel free to, email them to me. We're putting together those resources though for folks to use.
Yeah. Yeah, there's a few people that have actually posted, I think, just to the all panelists. But we'll have this chat available, and we'll take some of the resources that people have been offering and also put that in the post-event email. And yes, we are recording, so other people can watch this as well. So there's also questions about the reaching out, somebody as a school counselor at a large high school. Any suggestions on how to stay in touch and reach out to such a large amount of students at once? Have you, especially from a school counselor's standpoint, who doesn't necessarily have a class of things to teach, but wants to show that he's available, are there specific resources for them, or how are school districts dealing with that?
I'm not sure how school districts are dealing with it. There likely are resources through the American School Counseling Association's website. And I would say for school counselors, school counselors have always been, in my opinion, underappreciated and overtaxed. And we can say that probably about all educators. And during these times, I think it becomes even more clear at how much school counselors are needed.
Mm-hmm.
And your typical caseload is massive for a school counselor. It's up to, depending on the size of the school, could be anywhere between 250 and over 500. And so it's incredibly stressful. And one of the things that it takes a coordinated effort with your teachers. How do we identify the kids who are at need? Are there kids who are not showing up? Are there kids who are displaying some types of behaviors? And then prioritizing those kids to contact first, and then doing some sort of assessment to figure out, well, what's needed for this particular kid, and then identifying the appropriate resources for that individual. And it could be some type of virtual group that is run by the school counselor. It could be an individual session or two with the school counselor. Or it could be a referral to a mental health professional who's doing pro bono or sliding scale type of mental health via technology.
And moving forward a little bit, I like this question from Adam. Can you talk a little bit about what we as educators will need to be aware of to support our students as we restart the school year next fall, assuming we are able to do that?
Yeah. Boy. Assuming we're all able to meet in person again, I think all schools will likely need, a soft landing. They'll need to figure out how to, you know, reorient the kids, to, you know, debrief with the kids, to get them grounded, to assure them that they're safe, and then to, you know, set the expectations, and hopefully the expectations are realistic, for the kids and for the teachers. And, you know, I would say, just getting back to my earlier point, you know, the school counselors have, you know, maybe 500 kids, and the teachers also are going to, particularly high school teachers and middle school teachers, are dealing with, you know, a couple hundred kids or more themselves. Um, and hopefully that the schools will figure out a way, if the teachers haven't already, to really focus on, you know, their own homeroom, the kids that are in that group, or the kids that are kind of really popping up as kids in need, in their other classes, and to still figure out ways to communicate with one another and their school administrators and their school psychologists and their school counselors, who the kids are that are, maybe more at risk for, falling back even further.
Right. We are at 1:06 now, and so I do want to be respectful of everybody's time. As we mentioned, we will send out this recording, and we will be working with the College of Ed in the next few days to offer even more of these sessions. Clearly, from the number of folks and the active chat, it sounds like a resource and a gathering that people value. And I thank you so much, Dr. Liang. This has been wonderful. And thank you to all the teachers out there. From a parent, of course, you've probably seen all the social media saying, you know, that we are appreciative of teachers even more now than we ever have been. So thank you for all the quick pivoting that you've done and taking care of our kids. I'm going to get emotional. Our teachers here in the Bethlehem School District are just amazing, and I'm just really grateful. And I always speak for everyone I know on that. So. Thank you, Dr. Liang, and we will be in touch with everybody with the email resources. So have a good weekend or good days, and we'll be in touch soon.
Stay healthy, everyone.